Namaste. This is Dr. Mona. I'm a naturotherapist and diet consultant since last 17 years in Mumbai. So from Saffron Naturopath and Research Institute, we always talk about different diseases, how to treat their disease with the help of naturopathy. Yes, the naturopathy, totally a drugless therapy without a single side effect. Today's our topic is about PCOS and PCOD. Let's start. PCOD and PCOS means polycystic ovarian disease and polycystic ovarian syndrome. जनरली लोगों के दिमाग में एक मिथ होता है, जब तक गायनेक के पास आप नहीं जाते या तो प्रॉपर डॉक्टर को आप कंसल्ट नहीं करते हैं, तब तक एक कॉमन ह्यूमन बीइंग के लिए पीसीओडी और पीसीओएस में ज्यादा डिफरेंस नहीं समझता है। एक्चुअली ये टॉपिक डिस्कस करने का आज का मेन गोल है, बिकॉज आज की डेट में इंडिया में सबसे ज्यादा प्रॉब्लम्स बढ़ते जा रहे हैं पीसीओडी एंड पीसीओएस का, जो डायरेक्टली फीमेल हेल्थ पे, फर्टिलिटी पे और काफी सारे डिजीज को इफेक्ट करती है। सो टू नो एग्जैक्टली अबाउट द पीसीओएस एंड पीसीओडी इज वेरी मच इम्पोर्टेंट फॉर टुडेज लाइफ. Means you can treat yourself properly if you diagnose yourself properly, and understanding about these two hormonal changes is very much important. Nowadays we can see out of every 5 to 6 women or a girl, teenager girl, one is facing the same problem. Rather it is in a chronic or an acute problem. That means the problem may be started or the problem occurs from last so many years. The reason to talk about this topic is like, if a woman's puberty age, their growth period is going on and that lady or a girl is going to marry in future, then if the problem is continuously arising, to conceive or to make the fertile age is much more difficult. Before that, why not to solve the problem? So let's understand. We can see the PCOD and PCOS as an bifurcation point of view. Like what happened in the PCOD and PCOS, how we can bifurcate this thing, right? Basically, if we say the PCOD, it's a metabolic disorders. Over here in PCOD, the hormonal imbalances are there. The same thing over here in PCOS, it is like endocrine disorders. The immature follicles are there, and because of the immature follicles, PCOS occurs. Generally, in if you can say on an average ratio, PCOD is much more, like women are more prone, the ratio of PCOD is higher compared to the PCOS. More number of women are mostly facing the PCOD rather than PCOS. So you can say 20% in PCOS and 80% of the women are facing the PCOD problem, that is polycystic ovarian disease. Now what is the major difference? Let's see point to point, but let me very clear. PCOD is completely curable disease with the help of naturopathy, and PCOS is not curable, but of course with the proper treatment, with the proper food diet, with the help of naturopathy, it is completely manageable. From our last 17 years of experience, we had seen so many PCOS and PCOD problems. Specifically from the last 5 to 7 years of period, more and more lady or the woman or the girls are coming out with these problems. And we had seen with the help of naturopathy, different treatments and proper food and the lifestyle, there is really a great change, a great improvement, those who are suffering from any one of the disease. How? Before understanding the root cause and the treatment, let's clear the concept. What is exactly the PCOD and PCOS? Means, what is the major difference between PCOD and PCOS? Let's see first the PCOS, that is polycystic ovarian disease, right? So predominantly occurs higher in the woman, as we said. Basically, the reasons for the PCOD is, rather it is PCOS or PCOD. There are three major hormones responsible because the female structure is made up of these three major hormones: estrogen, progesterone and androgens. ये जो खेल है ना, ये पूरे तीन हार्मोन्स के लोचे का खेल है, जहाँ पे ये थ्री हार्मोन्स की कॉम्बिनेशन सिक्रीशंस जब प्रॉपर नहीं होती है, या तो एक कम ज्यादा सिक्रीट होने लगता है, या उसमें सिक्रीशंस में डिले होता है, प्रॉब्लम्स होता है। सो डायरेक्टली जब भी ओवरीज में कुछ ना कुछ प्रॉब्लम्स आ जाते हैं, सिस्ट के फॉर्म में या कोई भी फॉर्म में प्रॉब्लम्स आ जाते हैं, तभी ये प्रॉब्लम शुरू होता है। एंड ये जो प्रॉब्लम है सिर्फ फीमेल स्ट्रक्चर्स में ही होता है, बिकॉज फीमेल स्ट्रक्चर्स हैव सर्टेन fertile organs. Female has the capacity of reproduction. So what is the major three organs helping for the reproduction organs? You can say are ovaries. We are gifted with two major ovaries, right ovary and left ovary. The fetus which is developed inside the organ is called uterus. जो बच्चे का जन्म होता है, जो उसका ग्रोथ होता है, उसका पूरा डेवलपमेंट होता है, वो यूट्रस के अंदर होता है, जिसे हम हिंदी में बच्चादानी भी बोलते हैं। और जो ओवरीज और यूट्रस को जो कनेक्ट करता है, दैट इज कॉल्ड द फैलोपाइन ट्यूब. So if we say the pathophysiology of this whole reproductive system, both the ovaries secretes a specific hormones. With that help, the fallopian tube passes away to the uterus. Whatever the follicles are there, whatever the hormones are there, ovum is created, everything happens in these three related organs. So if one ovary is affected, no problem. There is a possibility of reproduction, fertility. If two ovaries are affected because of PCOD and PCOS, we can try to manage the things. Uterus, if the bulky uterus is there, it is curable. If the fibroids are inside the uterus, that is also treatable. But if the connection between the ovaries and uterus is called the fallopian tube, we have two tubes which is passing through both the ovaries and connect to the uterus. So if the fallopian tube is completely chopped up, then there is no chance of natural fertility or natural conceiving the child. There are so many surgeries, other treatments. There are chances to open the fallopian tube with the help of some IVF or something like that, you can say IUF nowadays. But if we talk about the natural conceiving, natural pregnancy, then three organs must be in their proper position with the proper functioning. That's why the importance of ovaries is very much for the female structure. Because see, I just want to explain you the thing. Like if we talk about the menopause, so nowadays we had seen early menopause also because of the lifestyle and so many things, stress, uneven sleeping pattern and everything. So what happened over there? In the early 40s or around below the 40 years of age, a female is facing the premenopausal or the menopausal phase. Over here, what happened? The menstrual cycle suddenly stopped or gradually minimized. But the secretions from the ovaries are still there. Uterus capacity is going down. So ऐसा देखा जाता है कि जो 45-50 इयर्स में ही एक कंप्लीट मोनोपोज आता है, तब तक जो हमारी ओवरीज रहती है वो एक्टिव रहती है. ओवरीज से जो हार्मोन सिक्रीशंस रहता है वो प्रॉपर रहता है, भले ही वो यूट्रस से साइकिल के फॉर्म में बाहर नहीं आ सकता है. बट जब हम कंप्लीट मोनोपोज जिसे बोलते हैं वो तभी होता है जब हमारे दोनों ओवरीज काम करना बंद करती है. That is called the complete menopause. This is just for the knowledge. If we talk about the genital organs, so we must know about all these things. Let's come to the PCOS and PCOD. So I told you like three major hormones are there, and estrogens, progesterone, and androgens. So rather it is in PCOD or PCOS, both are every three of each are responsible. But what happened in PCOD? Eggs are immature in PCOD problem. So because of the immature eggs, the periods becomes very much irregular, painful periods are there, Maybe sometimes you can skip or delay the problem. What happened if you are facing the PCOS, the same problem? What happened? Like increased in androgens. Due to increased level of androgens, periods stopped completely, or you can say you can skip the periods for 2 or 3 months without any contraceptive pills or hormone pills help. You can't get the proper cycle of periods monthly. So this is the major difference. If you have delayed cycle or irregular cycles, that is PCOD and that is completely curable. But the complete stop of your periodical cycle, that you can manage with the help of some